Welcome to The Explainer. You know, in healthcare, a single word, or even a single glance, can completely change a patient's life. Today, we're diving into the single most powerful tool you have in your kit. And believe me, it's not a scalpel or a high-tech scanner.
So think about it. With all the incredible technology we have, like MRI machines and robotic surgery, what's the one thing that can still make or break a patient's entire journey? What's the one thing that builds trust from the ground up? It's probably not what you're thinking.
That's right. It's you. Your ability to connect and communicate with your words and without them is the most critical instrument you will ever use. It's what builds trust, it's what ensures safety, and honestly, it's what defines the true art of care. So, how do we get really good at this? Well, here's our roadmap for today. We're going to start with the power you have before you even say hello, then it will move into the careful language of touch, and finally, we'll zoom out to see how you fit into the entire healthcare system. All right, first things first, your professional presence. You know, long before you introduce yourself, you are already sending messages to your patient. So let's break down exactly what your presence is saying loud and clear. Now look, this isn't just about a dress code. Every single one of these details, from your clean scrubs down to your short natural nails, sends a powerful, nonverbal message that says, you are safe with me. I pay attention to detail. These aren't just hospital rules. These are global safety standards from organizations like the CDC and the World Health Organization. Seriously, try to put yourself in the patient's shoes for a second. They're probably nervous, maybe even scared. When you walk in with an upright, calm posture and make gentle eye contact, it's instantly reassuring. You're not just another person in scrubs. You become a calming presence, and that trust you build in the first 30 seconds, it can make all the difference. Okay, now that we've covered what you're saying without speaking, let's talk about the most direct form of nonverbal communication there is, touch. In healthcare, touch is absolutely essential, but it is incredibly powerful. And because of that, it has to be handled with skill, with respect, and with care. This four-step process, it's completely non-negotiable, every single time. First, you explain what you're going to do. Then, you get clear verbal consent. You perform the task, and, this is so important, you monitor their reaction the entire time. This isn't just a protocol, it's the very foundation of respectful, compassionate care. You have to remember, a patient's body language speaks volumes. If you see guarded shoulders, that could be anxiety, so maybe you lower your voice. If they're tapping their foot, they might be scared, so you can narrate what you're doing to give them a sense of control. This isn't just about being nice. This is exactly the kind of situational awareness that certification exams love to test. And this right here is really the key. Think of your calm, deliberate actions as the antidote to a patient's fear. When you slow down, when you use clear language, you can actively de-escalate a tense situation and keep everyone safe. But let's be real, your role as a communicator doesn't just end when you leave the patient's room. In our modern healthcare world, your words have weight everywhere. On phone calls, in emails, and in every single note you type into a patient's record. You know, every phone call is an opportunity to either build up the institution's reputation or tear it down. A simple, structured protocol like this one does way more than just sound professional. It literally prevents errors that could alter someone's life. A misheard lab value or a privacy breach can have absolutely devastating consequences. And this is a big one. It's a career-defining rule. You must always use secure official channels. And you can never share protected health information, or PHI, over a personal text or social media. I mean, never. Doing that is a major HIPAA violation, and the consequences for you and your institution can be incredibly severe. Okay, so to be a really effective communicator, you have to know your audience and where you fit in the whole system. So let's just take a step back for a minute and map out the entire healthcare landscape. It'll help put everything in perspective. So it all starts with primary care. This is the foundation of the whole system. Think of it as the front door. It's your family doctor, your annual checkup. The whole point here is prevention, keeping people healthy from the get-go. Now, when a health issue needs a deeper look, a patient gets referred to secondary care. This is the world of specialists, the cardiologist for your heart, the dermatologist for your skin, the oncologist for cancer care. This is where that deep, focused expertise comes into play. And at the very top, you have tertiary care.
This is the most advanced, most complex care imaginable. We're talking organ transplants, complex neurosurgery, life support in the ICU. In this world, clear, rapid communication isn't just important, it is literally a matter of life and death, second by second. Seeing it all side by side like this really makes the progression clear, right? From a routine screening all the way to major surgery. And here's a pro tip. Misidentifying these levels of care is a super common mistake on certification exams, so this is definitely a slide you'll want to remember. Okay, time to bring it all home. We've seen the skills, we've seen the map of the system. Now let's talk about you. Let's look at how your communication skills are an absolutely vital part of keeping patients safe, no matter where you work. So, you might work in a bustling outpatient clinic, seeing dozens of patients an hour. Or you could be at the bedside in a quiet hospital room with one very sick patient. The setting changes, the pace is different, but those core principles of clear, empathetic communication, they're exactly the same. They never change. And finally, let's zoom all the way out. Your skills don't just help one person at a time. They support the broadest level of care there is, public health. We're talking about protecting entire communities from disease outbreaks through surveillance and health promotion. It's huge. So if you take one thing away from this explainer, let it be this. Effective communication is not a soft skill. It is a critical, technical, patient safety procedure. A simple miscommunication can directly lead to a lab error, and that error can lead to a misdiagnosis, a wrong treatment, and a devastating outcome. And that brings us to the end. As you go forward, I want you to think about this. Every single interaction you have is a chance to build a bridge of trust, to ensure someone's safety, and to practice the true art of care. So the next time you walk into a room, just ask yourself, what is one thing I'll do right now to make a difference?